Class 1, these are sodium blockers. Yeah, they block the sodium channels. And the class 1 having three groups, 1A, 1B, and 1C. Which one very weak? Weaker one. Weak blocker. Weak blocker.
Yes, sir. 1B.
1B is a weak. Okay. Which one very
Yes, sir.
strong? Very strong. How about moderate? 1A. Okay. Another property, state dependence. Yeah, they depend upon state. What the meaning? They depend upon state. So they can go for active gate. They can go for inactive gate. They can go for resting gate. Sodium gate having three stages while opening and closing: active, inactive, and rest. Okay. For active gate, 1A. For inactive gate, 1B. How about the 1C? 1C can block all gates. Understand? Yes. It's on. And what do you think about synchronism? Side effect of which drug? Synchronism. Which group? Synchronism. 1A quinidine disopyramide procainamide. Synchronism due to quinidine. Which group? 1A. Side effect SLE. Side effect heart failure. Okay, it also belongs to 1A, also belongs to 1. Done. SLE, procainamide. Heart failure, disopyramide. Heart failure, disopyramide. Which drug act like class 3? 1A also act like class 3. What is class 3? Potassium blocker. Yeah? Class 3 potassium blocker. Okay. Which one very strong antimuscarinic? Let me know. Strong antimuscarinic effect. Strong, very strong. Which one? Again, 1A. Okay. Okay. We must combine digoxin. Which group? Again, 1A. So 1A is having a lot of extra things in it. Yeah. 1A. Anything special you know about 1B? Anything special about 1B? Best after MI. Best after MI. Understand? Arrhythmia due to MI or heart attack treated by class 1B. Class 1B, lidocaine, maxilitine, procainide. Lidocaine, maxilitine, and procainide. What's the difference between lidocaine and maxilitine? Lidocaine only intravenous, maxilitine only oral. Oral medication patient can take by self, yeah, but the IV medication you must to be in hospital. So lidocaine used to control arrhythmia in a heart attack patient in hospital. When patient sent back to home, then we shift patient to maxilitine. Understand? There's a difference between maxilitine and lidocaine. IV 1B and 1 oral 1B, mexiletine and lidocaine. Okay, last one, 1C. Anything special about 1C? 1C very strong. It's your last line, okay? Never go first, second, third like this. Your last line for arrhythmia. Last line. You must put it in last. When if arrhythmia is not controlled by other drugs, we have class 1, we have class 2, we have class 3, we have class 4, yeah. So then at last you can go for 1C. What's the important problem with 1C? 1C can cause cardiac arrest. It's a big problem about this drug. At what time you never use 1C? If the patient have history of MI, if the patient have valve disease, if the patient have cardiomyopathy, if a healthy heart have arrhythmia, you can use 1C. But if any structural problem in heart, never use 1C. Understand? If heart is conductive system already weakened, have any pathology, arrhythmia with any other heart structural pathology, so you can't use 1C. Understand? Go for 1B, 1A, other 2, 3, 4 classes. Okay, never go for 1C. 1C contraindicated in 1C contraindicated in structural heart problem. Okay, if any problem in myocardium or valve or antiarrhythmic. Clear? So this 1C we must contraindicate in ischemic heart, especially ischemic heart disease. Ischemic heart disease including angina and MI. Okay, so you must contraindicate. 1C, if I write like this, contraindicate. You can memorize, okay? 1C. Is your 1 is your I. Contraindicate in ischemic heart disease and MI. It's very important, must keep in mind, okay? Okay, now let me know this one class act which phase of the action. If you remember normal physiology, if you remember this, your ventricle muscle potential having four phases there. Phase 0, phase 1, phase 2, phase 3. What happened here in cardiac muscle? Sodium influx. What happened here in cardiac muscle? Potassium efflux. And what happened here? Potassium efflux and calcium. Another thing here, potassium efflux and calcium in this is plateau, phase 2 plateau. Okay, what's your phase 3? This one, phase 0 is your depolarization and phase 3 is your repolarization. Here only potassium is coming out. So these are the four phases. Now you can see where you use sodium, phase 0. So Class 1 act on which phase of action potential in myocardium? Phase 0. Understand? Phase 0. Clear or not? Class 1 act on which phase of myocardium? Phase 0. Now what happens with the phase 0? If I using sodium blocker, you can see here, if I draw here like the graph here, so you can go very quickly upside and produce voltage this side and time this axis. So if you're using sodium blocker, what happened with your action potential? Action potential go very slowly. Action potential go up very slowly. You can see how much time taken. Oh, it's now bigger time, yeah, because you block sodium channel here. So when you apply sodium blocker, so what happened? Depolarization become slow. So what is our aim here? My aim to reduce the heart rate. So heart rate automatically go down. Clear? Automatically go down. So class 1 act on phase 0. Class 1 act on phase 0. Understand? Class 1 act on phase 0. So what they're doing, all these drugs, they increase the action potential duration. You can see the time here. You can see the time here. Okay. You can see the time. This is normal one. It's a time axis. 0, 1, 2, 3, 4, 5, 6 in millisecond. Okay. This is a time. This is a voltage axis. So what happened when you apply the sodium blocker? You can see this a bigger time, yeah? So it take more time. If more time, of course, in 1 minute beat, number of beat will decrease. Yeah, number of beat. If you using lot of time for one action potential duration will increase. Action potential duration will increase. Another terminology, if you remember, refractory period, effective refractory period. What is refractory period? Refractory period. Refractory period, the second impulse not able to excite. Yeah, second impulse is your basic physiology. Second impulse not able to re-excite the cell. So if you increase the refractory period, if you increase the refresh, second impulse will not come. So what happens with the heart rate? Heart rate automatically down. Understand? Heart rate will automatically going down. Okay, now move on to class 2. Move on class 2. Very easy. We already done class 2 beta blockers. Okay, class 2. Class 2 act on which phase? This one 0, 1, 2, 3. Where is your 4? What? This is my 4. Here is your 4. Okay. For second current, for second, again 0, 1, 2, 3, again here, again here. This one is your 4. Understand? So at this area, if you increase the slope, for example, if you increase the slope here, okay, this slope, if you increase the slope till here, what happens? If you increase this slope, then your heart rate, if you increase this slope, your heart rate become faster, yeah, because the time is now short. It's your time. If you decrease this slope, this side, if you decrease this slope like this, then what happens? Your time now too much. You can see here big gap here, yeah. So it's a game here. So what happened here? Focus here. This one, number one is normal, okay, and this one below one, this one, when you increase the slope upside, it's mean you stimulate the heart. When you decrease this, it's decrease the slope. Here is your slope here. This is your slope, normal slope here, okay. So if you move it here, it's mean you stimulate. If you move it down, it's mean you block it. Yeah, this slope is going down. The slope is going down. This slope is your phase 4. This slope is your phase 4. Beta blocker act on phase 4. Understand? Beta blockers act on phase 4. This phase 4, beta receptor, the sympathetic system, if sympathetic system come, sympathetic system, not epinephrine, they stimulate this. Here we're using beta 1 receptor. They stimulate, slope become up. If you block this, slope become down. If slope become down, I draw the picture here in the more clear. Here, try to see the slope. I draw normal, okay? Here's the slope here. Again go up, again go down. The phase is 0, 1, 2, 3, 4. Okay. Now you must compare with the following. Okay. I draw the same level. Now you see here what happened here. You can see if you increase the slope, the big distance here. Yeah. This one's first impulse, this one second impulse, this one first impulse, this one second impulse. How much time you take here? Of course, little time. How much time you take here? Oh, it's a very big time. Yeah. So what you done here? You can see the slope here. Yeah. This slope is very high. Now this slope is already down. Yeah. So this your phase 4 is going down. What you done here? You done beta block. Understand? This is class to act here and decrease the activity. The second time stimulation decrease the sympathetic activity, decrease the rate. Okay. So any, listen here, any effect on action potential duration? No effect on action potential duration. You can see here normal. This one is normal. Yeah. It's between two action potential. The distance is increased between two action potential. Second impulse come little late. Okay. The second impulse will come a bit late. Second impulse will come a bit late. Understand? I will ask you one question more. One question. Okay, come here. This is zero phase here. Yeah, this is zero phase here, and this one here is your one phase here. This is two phase here. Sodium blocker can act on conductive system. Yes or no? This your conductive system current like this. In conductive system, how many phases here? Number one, zero. Okay. Number two, this one is your one. This one is your four. This part is four. Okay. But second, this your four. Which phase is missing? So it's not one here. You must write here three. This one is three. This your depolarization. This your repolarization. This for second excitation. No plateau here. Okay. No plateau here. So one and two missing. 1 and 2 missing in nodal. This is node conductive system. Nodes correct. Okay. Can sodium blocker act on conductive system? Yes or no? First, I want to check your knowledge, previous knowledge. Can sodium blocker block conductive system? Yes or no? Anyone?
Yes, sir.
Okay, yes. How yes? You forget everything about physiology, eh? Conductive system, depolarization, calcium. Myocardium, depolarization, sodium. If you remember or not. Depolarization, sodium in myocardium. Conductive system, zero phase is not done by sodium. Listen here. Conductive system, zero phase is your depolarization. Yeah, what is the phase zero? Depolarization. What is the phase three? Repolarization. Here phase zero, here phase three. Yeah, so phase zero done by sodium. Sodium blocker only act on myocardium, never act on nodal system. Never act on nodal. Understand or not? Which class can act on node? 1, 2, 3, 4. Which class act on node? 1, 2, 3, 4. Four classes there. Yeah. Number one, sodium blocker. Number two, potassium blocker. Number two, beta blocker. Number three, potassium blocker. Number four, calcium blocker. Class 4 act on conductive system because they are calcium blocker. Yeah. Class 4 can act on zero phase of conductive system. This is not your myocardium. Okay. This must keep in mind. So this is a calcium here. This is your calcium. So this calcium responsible for depolarization. Calcium responsible for depolarization of conductive system. Calcium responsible for depolarization of conductive system. Clear? Clear or not? So
Yes, sir.
the sodium blocker never act on conductive. This is your conductive system, not mix this the conductive system. Okay, conductive system zero phase is done by calcium and myocardium muscle. Myocardium zero phase done by sodium. Okay, so sodium blocker this is class 1. Here just can act class 4. Calcium blocker can act on conductive system. This is a difference. Okay, not mixture zero phase. But you can see class 1 also act on zero phase, class 4 also act on zero phase, but the zero phase is not same. Okay, zero phase belongs to conductive system done by calcium channel. Zero phase belongs to
My
myocardium done by sodium channel. So
sodium.
that's why sodium blocker. Understand? It's a difference between sodium blocker and calcium blocker. Okay, now let me know again. Remind: can beta blocker act on conductive system? Yes, because it's four phase also here. Force field house. If you remember normal physiology, what is the location of beta 1? All heart. What is the location of beta 1? All heart. Also muscle, also conductive system. Understand? Beta 1 receptor present everywhere on heart. Sympathetic supply present everywhere on heart. So what happened here? This phase 4 slope, if beta blocker act on, now again come here, the conductive system, 1, phase 0, this is your phase 3, this is your phase 4. Okay, again 0, 3, 4, 0, 3, and 4. When you apply beta blocker, this is your fourth phase. This is your fourth phase. When you apply beta blocker, what happens? Can you see the slope going down? You can see the slope going down, yeah? This slope is going down. This slope is very high up. Now the slope, you can see between two action potential, the distance, yeah? This is one wave, another wave, another wave, another wave. The distance increase, you can see take more time. Take more time, clear? So phase 4. So beta blocker you can use in if arrhythmia due to myocardium, if any person come to you having sinus tachycardia, what you can use? You can use beta blocker. Can you use sodium blocker? Patient come to you with sinus tachycardia. Sinus tachycardia mean not have any other pathology, just SA node give you more discharge and patient have sinus tachycardia. Sinus tachycardia due to SA node. So SA node, can you decrease activity by using sodium blocker? No, because the problem in SA node, SA node produce lot of current. Understand? Give beta blocker. For sinus tachycardia, give beta blocker. For sinus tachycardia, give class 4 calcium blocker will be more effective. Understand? So if any patient have conductive problem, conductive system arrhythmia due to conductive system, then you prefer calcium blocker. Clear? Then you prefer calcium blocker. If any myocardium issue, then you prefer sodium blocker. If any conductive system issue because related with the calcium, then you prefer calcium blocker. Understand? This is your class 1, this is your class 4. Class 1 and class 4. Okay, class 2 clear? That's your beta blocker. What type beta blocker? Selective beta blocker. Atenolol, bisoprolol, metoprolol. Never use pindolol, acetobutolol. Acetobutolol, pindolol, they have intrinsic sympathetic activity. Yeah? Pindolol and acetobutolol, they have intrinsic stimulating property. So they have intrinsic stimulating property. They can increase the heart rate. They can increase the heart rate. Understand? Class 2 done. It's a beta blocker. Class 2 done. Okay, what you need to take care about class 2? Asthma. What you need to take care about class 2? COPD. What thing you need to take care about class 2? Diabetes. Okay. So these are just precautions. Must take care if you're using beta blocker. Must prefer selective beta blocker. Selective beta blocker, bisoprolol, metoprolol, atenolol. Bisoprolol, metoprolol, atenolol. Okay. Bisoprolol, metoprolol, and atenolol. Till here done? Okay. Now move next one. Class 3. Class 3 act on which phase? First we decide the phase. Then we see what happens. Class 3 act on which phase? Phase 1. Here come on this picture. This phase 1, phase 2, phase 3, phase 4. This is your phase 0. This is your phase 1. This is your phase 2. This is your phase 3. This is phase 4. Phase 0, sodium blocker. Phase 4, let me know. Phase 4, which drug? Just now we finished. Beta blocker. Phase 4, beta blocker. Okay. Phase 0, block by sodium channel. Sodium channel blocker. Sodium blocker. How about the class 3? Class 3 act on 3. What is 3 phase? Phase 3 is your potassium efflux. Is your potassium efflux. Potassium efflux means repolarization. Potassium efflux means repolarization. What happened in repolarization? Potassium channel open. Yeah, this is your phase 3. Phase 3. If you act here on phase 3 before you see the picture for sodium blocker, okay, Okay, this is normal. What happened with the phase 1? Oh, phase 0 will go like this. Yeah, before phase 0 was here. Phase 0 was here. Yeah, so when you give, now this is phase 0. Now you can see move till here. It's now slowly rising up. Yeah, it take more time. So now what happened with the 3? The 3 you can see here quickly going down. It's your 3. So now what happened if you block the 3? What will the picture here? Sodium blocker act here. So, oh, can you see what happened here? This is your normal here. Phase 3 was here. When you apply potassium blocker, then potassium coming out very slowly. If potassium coming out very slowly, then this phase 3 take more time. What is phase 3? Phase 3 is your repolarization. Understand? Phase 3 is your repolarization. So if you increase the time duration for repolarization, listen here carefully, okay? You increase the time duration for repolarization. This your current here stay for more longer time. What happened here? Action potential duration again increase. Can you see here time here? Understand? So what happened with phase 3? Phase 3 become more slow. This you already know, like the sodium open, okay, depolarization done. Suddenly potassium open, repolarization done very quickly. Yeah, rapid up, then rapid down. Understand? So if you block the potassium channel blocker, they block many potassium channels. Can potassium come out? Potassium
No.
not coming out. Understand? So phase 3 is your repolarization becomes slow, becomes slow, becomes slow, becomes slow. Can you differentiate which drug I am using here? No, you guys tell me. What's the difference between this 1 and 2? Let me know.
Rapid repolarization and
So what happened here? Slow depolarization. You can see going up very slowly. I not draw like this. Yeah, I'm not going up very quickly. I'm moving up slowly. Understand? So which drug act on picture 1?